All right. Good morning, everybody. Not sure if you can see me okay or not. Sun is shiny here, and so a little difficult for me to see. We're going to go ahead and get started. I'm going to do some quick introductions, and I will go back and forth with the slide deck a little bit. So bear with us as we do this. We did not hire a production company to help us with a virtual conference. As a bunch of healthcare IT folks, we thought we could handle some of this on our own, so bear with us as we go through this. We will be sharing with you guys a little bit more on some of the logistics about today. But why don't we go ahead and get started? I want to thank everybody for joining us this morning. This is day 2 of our CSOHIMSS virtual conference. We're excited to have a lineup of guest presenters today who get to tell us about what's going on in their world as it relates to pandemic memoirs. And again, the theme of our conference, those of you who hopefully got a chance to join us last week, is about how do we learn from something like this pandemic that we're dealing with, and help our future selves be more resilient to dealing with something like this in the future. So with that, quick introduction. My name is Alex Vaillancourt. I am the president of the CSOHIMSS board, and I'm going to switch over to our PowerPoint here for just a minute. Make sure everybody can see and hear. So I'll be fairly brief this morning. As you know, this is day 2 of our conference. Normally when we were prior to being virtual conferences, this would have been a single full day. And so we split this up into 2 half days. So again, thank you guys for joining, particularly here on a Friday morning. What I wanted to share with the group here, not to go through introductions of all of our board members, but I thought I'd try to point out, as members of CSOHIMSS, which I hope everybody in the audience is, we have certain roles within the board trying to represent areas and services that CSOHIMSS represents. And so what you see here is everything from membership and making sure that we're managing our membership and communications, to programs and services that we try to offer to our community, HIE liaison, what do we do in that space, and interoperability, advocacy within state and national, working with HIMSS, national there as well, scholarships and sponsorships. And so I highlight these roles because the folks that you see on the screen represent functions within the board that our CSOHIMSS really tries to help maintain. So I say that because those of you who are members of CSOHIMSS, I would encourage you to get involved. The folks that you see on the screen here, we are a volunteer board. And so what that means is some of the activities and opportunities that we try to help bring to our membership community really rely on some folks who have a passion for certain areas within healthcare IT, as I just mentioned. So if there's something you'd like to get involved in, please reach out either to myself or any one of the folks that you see here on the board, asking how you can help get involved. With that, I am going to turn this over to Rob Stillman. Rob, are you on the line?
I am on. Can you hear me?
Yes, I sure can.
All right. Good morning. So this is, as Alex mentioned, day 2. I'll do a quick introduction. My name is Rob Stillman. I am the program chair for CSOHIMSS. My day job, I am the director of clinical and research informatics at the James Cancer Hospital. I am a nurse by background. This is my first go round at being on a board at CSOHIMSS, so I am proud that I can offer contributions. And the conference that from last week and this week was the effort of lots of people getting together on the screen, and as Alex mentioned, all volunteer to put this conference together. And I think we have a great mix of IT and providers that are presenting. Today is probably a little provider heavy. Last week might have been a little bit more IT heavy, but I think a great mix nonetheless. Everyone should hopefully have received their appointments that have the Zoom links. If you're on this call, you likely have. If you have friends who are having trouble getting in, please share those links with them. But just like we did last week, we'll have a main Zoom webinar that you all are in now. And then our breakout sessions will have different Zoom meetings, and those are all indicated on the agenda as you see before you. So we have some great speakers lined up today and look forward to having everyone participate. Please don't hesitate to ask questions of our speakers and moderators, and we'll do what we can to answer questions. We will be recording all of these as well and getting those out probably via YouTube from what I understand, and those will be on the CSOHIMSS website. So for this particular Zoom meeting, this is set up in webinar fashion. Our other one is mine actually from the OSU, so that's more in meeting fashion, so probably more of what you're accustomed to. This particular one that we're in, and for probably most of them, except for I think 2 of the breakouts anyway, will be within this webinar format, and you do have the ability to use the Q&A. And as I mentioned, there are 2 breakout sessions, so 2 during the 10 a.m. and 2 during the 11 a.m. session. So if you will probably just need to double check what you have, which Zoom you need, and join that. And then everyone will rejoin at the noon hour for our CIO panel led by Alex. And we are excited to be able to give out a couple of scholarship awards as well. So please make sure that I believe Alex is at the beginning. So please, it's great to be able to award students money to continue to go to school. So that's what I've got.
Thank you, Rob. And so if I can just add for a brief moment. So if you look at the agenda here, you'll see that there's a passcode for each one of those Zooms, and just making sure that there's no confusion. The ones that say CSOHIMSS 20 is this main kind of auditorium session, and you are welcome to stay. This Zoom will be live all the way through to 1 o'clock today. So those with the CSOHIMSS 20, that's here in this Zoom, this room, this virtual room. And so the ones that you see that say CSOHIMSS, so you see that on the agenda as session 1A, the telehealth panel, and the 11 o'clock rapid implementation of telehealth. Those will be in a separate Zoom, and that link will take you there. So just want to make sure there's no confusion with the breakouts. It seemed to be very, very smooth last week. So knock on wood that we didn't cause any confusion. The feedback we had was pretty good. So, all right, let's continue our agenda here. You know, we talked a little bit last week as well, the theme of our conference being pandemic memoirs. You know, and over the last week alone, you know, we've seen COVID rising everywhere, countries that are beginning to go back on lockdown, and we even have states here in the US who are starting some of the lockdown processes. So, you know, I think this is an appropriate topic, and I hope that our audience gets a chance to, you know, really absorb, you know, the messages that our presenters bring here with this. You know, we hope that this all ends soon, but it doesn't seem likely. So this is great to be able to help our future selves really understand and be able to look back someday and say, what did we learn from that? What changed healthcare for the better? And how do we learn from that going forward? So what I also want to take just a couple minutes, hang on if my PowerPoint will forward. I also want to take just a minute to say a huge thank you to our session and program sponsors. even though we are in a virtual session, it still costs money with Zoom. It still costs money to help pull together programs like this. And so thank you very much for our sponsors. If I can figure out how to do that on Zoom here, I would like and ask that we've got a couple representatives from our platinum sponsors just to give them a couple minutes to introduce their organization and what they do. They're tremendous partners in helping us pull this together, not only just from a funding perspective, but also helping us with guest speakers and helping line up some industry experts to bring here to the table here. So with that, again, if I can figure out how to do this, we will try to unmute a couple of our folks. So Jim from Fortinet, can you hear us?
Yes, Alex. Good morning. Can you hear me?
I sure can.
Fantastic. Thank you. Thank you so much for the time. And first and foremost, thank you for allowing us to be a part of the HIMSS community. Good morning, everybody. Just a little bit about myself. My name is Jim Stahl. I am the Director of Sales for Fortinet in the Ohio Valley Enterprise. Fortinet is a leading provider of network security solutions, SD-WAN, cloud, endpoint, secure access, and AI advanced threat protection. These solutions are delivered through Fortinet's security fabric. This can be done organically by our products or through our integrated third-party partners. We believe our comprehensive approach of security integration provides the most innovative, highest performing network security fabric for the IT environment. Ohio Valley Enterprise, the healthcare, represents actually our largest vertical segment, and a lot of key topics that we've been speaking with our customers. Obviously the pandemic quite a bit, but obviously some key topics that are resonating within healthcare are visibility within distributed healthcare enterprise, insider threat protection, and corporate hybrid cloud infrastructure, just to mention a few. If I can help connect you to any of our thought leaders, including our healthcare CISO, please let me know. And thank you again, Alex, and to everyone, thank you for allowing us to participate with you all this week.
Can you hear me okay, Alex? You were on mute.
Yep, I see that. Sorry about that. Is that John?
Yes. Can you hear me all right?
I sure can. Thank you so much.
So it's funny that happened because I think the number one challenge I've had on the pandemic is the mute button. Sometimes triple mute. Sometimes, John, you turned your camera off, but you didn't turn off the mute button when one of the kids walked in or the dog was barking. So
yep.
Thanks for having us from Cisco here. John O'Malley, I'm an account manager. I cover several hospitals in the Southwest Ohio region, most of them Epic, but a couple Meditech. We're thrilled to be a part of Central Southern Ohio HIMSS. I've been involved at conferences in Dayton, Columbus, and Cincinnati for over 8 years. And I'm just really pleased to see that this is continuing. This is, I look at this kind of like the Grand Ole Opry. You've got to find a way to keep it going, and so I commend you all for that, and especially as volunteers. Where we've seen some big trends, which is no surprise, but Cisco has invested heavily in, is the work from home, the collaboration, like we're doing here, and like with telehealth, data center, the scaling of the data center, getting enough bandwidth so everybody could talk and do their work from home. And then security has always been a huge, as we know, for all of us. Here recently, especially with emails coming out from the FBI to be out on the lookout. We all need to be stewards of managing our email and making sure no one's trying to spoof us. And then the last one I'm seeing is a lot of location tracking. A little bit of contact tracing, that seems to be for the bigger cities, but a lot of location tracking of where things are so we can be as efficient and we're not darting in and out of rooms so that we're not spreading or we're not adding to the potential risk. So with that, we appreciate it. We're looking forward to a great day. Alex, back to you.
Yeah, thank you, John. I appreciate that. And do we have Andy on from UpDocs?
Yes, can you hear me okay, Alex?
Sure can. Great, thank you.
Awesome, thank you. And again, just want to echo everyone else's thanks. We know it's taken a lot to get this together in these trying circumstances. So again, just a huge thank you to the CSOHIMSS team and all the attendees for making these sessions great. We're really looking forward to today and appreciate the opportunity. So my name is Andy Gila. I run product management at UpDocs. Just to give you guys just a high level overview of who UpDocs is and what we do. We're a local company. We're founded in 2009 in Dublin, Ohio, still headquartered there in the Bridge Park area. We are a healthcare communications platform. So our goal is to provide the tools and workflows needed in order to support a virtual and digital office. So for healthcare organizations, we help with administrative functions such as document management, e-faxing, and provider-to-provider communication, and also have a variety of patient-facing solutions from HIPAA-compliant texting to broadcast messaging and telehealth, which has been a big thing this year. Our goal really is to serve as a digital front door for all the various types of information that come inbound to healthcare organizations and try to digitize and streamline that as much as possible, and then help with assisting and setting up workflows that really optimize and save money and save staff time so they could be leveraged to drive other value added initiatives such as helping patients, driving revenue, and just being able to sustain, especially in these trying times. So again, we really appreciate the opportunity. We've had the fortunate luck of being able to be integrated with hundreds of EHRs, hundreds of millions of patients in the US, and work very closely with some of the presenters both from last week and this week. So again, we're just really fortunate. And if you'd like to learn more, you can go to www.updocs.com or email us at info@updocs.com. But again, can't echo enough thanks to everyone for helping put this together and just the Central Ohio community as a whole. Thanks, Alex.
Thank you so much, Andy. I appreciate that. All right. So thank you again to our platinum sponsors. Absolutely want to make sure we also acknowledge some of our other sponsors. So we have Cover My Meds, who we've had very active in this market. As you probably may or may not know, a couple of our board members have been from Cover My Meds, and so great to have them partnered with us. Nordic as well as VirtuaStream. So again, thank you guys very much to our premier sponsors who have helped us with this. And certainly last but not least, and again, if my PowerPoint would cooperate, Trinisys. And so thank you to our elite sponsor, Trinisys, for helping us with this program and making sure that this comes off successfully. With that, I know we're actually a couple minutes ahead of schedule. So we are going to try to get set up and see if Mr. Granat is in the audience, and we will bring him up on stage to help get set up. So give us just a minute. Rob or any of the other board members, would you like to comment or add anything?
Just one final note. There are, for those of you who are keeping up with your certification for CP or CAHIMSS, the certification CEU credit sheet is on our website, so please make sure you grab that. You get quite a few for this if you have attended both sessions, so please make sure you grab that.
Yeah, great point, Rob. Thank you for sharing that. And remind me again, is that a form that we need to send out that folks just need to keep their agenda?
It's actually a form that it's available on the CSOHIMSS website, and all you need to do is just download it and attest to the sessions that you submitted. And for those of you who are accustomed to it, you can go right into the into your HIMSS account and just add them right into your transcript.
Yep. All right, great. So again, thank you guys for joining this morning. We're going to take just a short break, trying to get set up for our 9 o'clock keynote. If everybody wants to take a quick break to grab a cup of coffee or a drink or a beverage of choice, feel free to do that now while we get set up, and we will get started at 9 o'clock.